the Toronto Star, I'm Saba Eitizaz, and this matters. If you're still coming to grips with the coronavirus, I'm sorry, but there is another virus in town. This time it's monkeypox, and it's already here. As of today's recording, Canada's Public Health Agency says there are 15 confirmed cases in Quebec, and health officials are investigating more, including 4 in Toronto. Before you start cringing in horror at the prospect of another lockdown, let me be clear. This is not COVID all over again. The rare disease is not new. It's been around parts of Africa for decades, but some scientists are saying the current numbers and outbreaks around the world are a little unusual and no longer that predictable. According to the WHO, there are about 90 confirmed cases in 12 countries, including Canada. So what's going on? Is it time to worry, or are we just hyper anxious since COVID took over our lives? We might not know yet, but I spoke to Star reporter May Warren to find out what we do know about monkeypox so far. Hi May, thanks for joining me.
Thanks for having me.
So what exactly is monkeypox? Let's start with the basics.
Yeah, good question. So unlike COVID, it's not a new virus. It's something that's been around for decades, and it's been kind of endemic. So kind of circulating little outbreaks here and there in parts of Central and West Africa, particularly the Democratic Republic of Congo. And it's in this family of viruses called orthopox virus, which is related to smallpox, which some listeners, especially older ones, might have heard of. And it often spreads from animals to humans. It was first discovered in the late 50s in monkeys, hence the name. And it's often spread now through like rodents and animals like that, but it can spread through people as well. And it causes kind of flu-like symptoms like fever, muscle aches, headaches, and then pox. So kind of like lesions, that type of thing.
Okay, yeah, I was going to ask you because it's monkeypox, so does it come from monkeys? So in a way, it is transmitted through there.
That was where it was discovered from, yes. But there's been cases of it being transmitted through, all kinds of different animals. There was actually an outbreak in the early 2000s in the US where people were getting it from prairie dogs and transmitting it through there.
Okay, so can you elaborate a little bit more of the kinds of symptoms someone can experience with this virus?
Yeah, so typically it would be flu-like symptoms such as a fever, headache, muscle aches, swelling of the lymph nodes, maybe things like that. And then rash or pox. So kind of like lesions, blister type things on the skin.
So some of these symptoms seem to be in common with COVID as well, which can be pretty confusing for people, I can imagine. And I just wanted to ask you, wasn't pox eradicated? Should we be worried that this disease is a pox virus?
So it is a pox virus in that it's related to smallpox in the same family, but smallpox, you're right, was eradicated. And that's why we don't get a vaccine for it anymore. Typically people who are maybe 50 and up may have had the vaccine as a kid, but then we stopped it because smallpox was eradicated kind of around that time.
So there are some people, including me, who never got the chickenpox. I'm thinking of all of the pox viruses here. And I've heard it's supposed to be more risky if you get it in your adult years. So is there any link to this? And could people who've never had the chickenpox be more susceptible to this maybe? I know it's still early days, but is there anything that we know?
Yeah, so sometimes it can be confused with chickenpox because the pox kind of looks similar, but they're actually like different types of viruses. So there's not really a link there, and you don't have to worry about your chickenpox status impacting monkeypox risk.
Phew, okay. Is it highly contagious? How quickly does it spread? How serious can it get? Any information on that yet?
Yeah, so historically, researchers and scientists have studied it in parts of West and Central Africa. So they do have data on it. And they found that although it can spread from human to human, it usually doesn't spread that quickly. And it requires a lot of like really close contact. And I know the close contact word people remember from COVID and all that. But in the past, it's really required, say being in the same household as someone or sharing the same bed linen, things like that with someone who has the sores. And it doesn't spread that quickly. So that's good. I will say that with this current situation, one of the new things that researchers are a little bit concerned about is that they haven't seen this kind of human to human transmission outside of the Central West Africa region before, really. So they're wondering, is there something about this monkeypox outbreak that, it is a little more contagious? Is it possibly like a new strain that's a little more contagious or something like that? Or is it just that, maybe it was just the right conditions for a lot of spread to happen outside of the regions where they've normally seen it? And again, it's not a new disease. It's been around for decades. It's just been more confined to certain regions. So it's now in new regions, and we're now seeing larger chains of transmission between people, and they don't seem to all be connected. They're in several different countries in Europe now, Canada, Australia has reported cases. So that's a bit strange. And that's kind of the mystery that scientists are trying to solve right now.
Right. From what I've gathered, this is not an airborne virus from the research so far, and it requires human-to-human contact. I was reading up that sometimes it's sexual contact that it can transmit through, right?
So I think it can be airborne. I think the word airborne scares people because sometimes thinking like the movie Outbreak and like if you breathe in one breath of it, you're going to get it. You have a hazmat suit. But I think researchers that I spoke to were saying like it can be transmitted that way, but you kind of have to be exposed to a lot of virus to get sick in the past. And in the past, it actually hasn't been sexually transmitted, but they're wondering if maybe this is something new about this current outbreak. And one pattern that researchers have noticed is that a lot of the people who currently are sick with it are gay or bisexual men. And of course, they want to be very careful not to stigmatize that community because obviously it can infect anyone, but they're kind of noticing that as part of the puzzle and wondering if maybe they just didn't know before that it could be sexually transmitted, or again, maybe there's something new about what we're seeing now. Or they could also just, through sexual contact, you have close contact. So maybe that's also it, right?
We'll be right back. And you're already speaking to it, but that's what I wanted to lead into about how we're feeling that there's something different about the cases we're seeing now. If you can just kind of lay out the situation for us, like there are outbreaks in various parts of the world right now, small outbreaks, but still.
Yeah. So in the past, they would see a travel-related case here or there. Maybe a traveler came from Democratic Republic of Congo and infected maybe one or two people in a different region. But they haven't seen these kind of large trains of transmission impacting multiple people. And we've got cases in the UK, Spain, Portugal, Sweden, several countries. And they don't know exactly how they're all related. Like some of them have links to each other or to travel, but not all of them. So they're really looking at that and trying to figure out, is there something new here? Or maybe was there just the right conditions for it to spread and it's been spreading undetected for a while and they weren't noticing it? And I think another important thing to remember is, we're very bruised from the COVID experience, a couple years of not knowing what's going on and hearing something is mild and then all of a sudden we're at DEFCON 5 and the world is falling, right? So I think everyone's kind of a bit traumatized by that, but it is a good thing that these cases are being detected and reported and that scientists are working together to contain, these outbreaks and learn as much as they can about them. So it can be alarming when we see these headlines, but it doesn't necessarily mean it's going to be a new pandemic at all.
And I know that Spain has issued a nationwide alert after a small outbreak just to be on the safe side. Do we see any action or plans from the federal and provincial health officials here?
Yeah. So Health Canada issued a statement and they were, kind of saying that healthcare providers should kind of be on the lookout for this. So if someone comes in with, pox, maybe ask a couple more questions and just be looking for this so that they can, again, detect cases and have an idea of how far it's spread. And they're also doing contact tracing. So they're trying to track down the contacts of people who are suspected cases, and that could lead to more cases as well.
So what's the treatment for this? Are we going to need another vaccine?
So the good news is that because it is so closely related to smallpox, there is some evidence that the smallpox vaccine can help protect against this. And so people who are roughly like over the age of about 50 in Canada probably got that vaccine as a kid. But, it's hard to know how much protection they would still have with that. However, what they can do if they have a version of the smallpox vaccine, healthcare professionals can actually offer it to people who've been exposed. So it's this strategy called like ring vaccination, where after someone is exposed, you can give it to them and that can actually help to stop the outbreak. So that's good news. As well, there are some antiviral treatments for smallpox that could be kind of repurposed for this. And it's thought that they might work on this. So again, it's not like we're starting from scratch, like with COVID, where we had a totally new virus and we had to try and learn everything in real time and race to keep up with it. We do have a good body of knowledge about it because it has existed for decades.
And what about precautions? Can we avoid getting this?
So again, the good news is that a lot of the precautions that we were taking for COVID, such as wearing masks, can help also protect against monkeypox. However, at this time, in this moment that we're in now, they're not thinking that it's something that is as contagious as current COVID Omicron variants, and that it's not something that you would say pick up at the grocery store or on public transit. You would really need to be in close proximity with someone who had it, say someone in your household or a partner or something like that.
I just wanted to clarify earlier because you were talking about there's already a vaccine of sorts and this has been around for a while. Has there been known to be medicine that's effective to deal with this?
Yeah, I think there is at least one like smallpox therapy treatment that could be repurposed for this. So it's not specifically for monkeypox, but because smallpox and monkeypox have so much in common virus-wise, the thinking is that they could, potentially use this.
Okay. I know it's early days, but just be honest. From what we know so far, should we be worried? Could monkeypox pandemic be next on the horizon? Is there any way that this virus could become more transmissible and more of a global threat?
Yeah, so the experts that I talked to were saying, it's something to keep an eye on. It's a little bit concerning to see this new pattern in the transmission, but right now they're not really thinking that, it will turn into a pandemic like COVID. One expert told me she'd be very surprised if that happened, but, you might see more monkeypox outbreaks than we've seen before. We might hear it more, we might hear about more cases, but she would be surprised if it became this all-encompassing pandemic like COVID. But, you never know. And the experience with COVID was that a lot of times things change quickly. But for now, a lot of the experts seem reasonably confident that, we can contain this. And I should say too, past outbreaks, they've had good success containing those with giving people a smallpox vaccine, with, contact tracing and isolation and quarantine of patients and things like that. So we do have tools already, and we do have knowledge about the virus and the disease.
I'm going to take that as my reassurance for a little while at least. So are there any fatalities linked with this disease so far?
So for sure in, the parts of West and Central Africa, such as Democratic Republic of Congo, where it's been circulating for years, there have been deaths. But this new situation with it spreading in the different countries, as far as I know, there haven't been any deaths linked to that yet.
All right. Well, thank you so much for clarifying the situation and bringing a bit of balance to our lives when it comes to this. Thank you, May.
Thank you so much for having me.
I was talking to Star reporter May Warren. That's it for today. Thanks so much for listening. I'm your host, Saba Eitizaz. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.